Hi, everyone. Welcome. I am Angela Love-Zaranka from Lactation Education Resources.
And I am her co-pilot, Sekeita Lewis-Johnson, also here sitting for Lactation Education Resources. I am the Accredited Provider Program Director.
Excellent. And I'm the program director for LER. And thank you for joining us today. My background, just to give you a little bit of background about myself, is that I have been working in community support for over 30 years. I've been board certified for 25. I've worked in a hospital. I've worked in a private practice. I've done a lot of policy work, advocacy work, board work, etc. over the past many years. How about you, Sakita?
Yeah, I am a former labor and delivery nurse turned family nurse practitioner and birth doula. I am also a lactation consultant, and I've been a consultant for 15 years now. I bring you greetings. I've had a host of experiences in hospital settings, community settings, teaching, and yeah, very well-rounded experience. So I'm here to share some of that experience with you all. Take what you will and leave what you don't want.
Perfect. All right. Well, let's get started by telling you how you can interact with us. And so if you'd like to ask a question or make a comment, you can access the question box here as in the blue arrow. If you're participating today on a laptop or on a computer, you can find the arrow here and you'll see that by that blue arrow, that this is where you can chime in. Or if you're on your mobile device, it can be found along this bottom bar at the bottom bar of the app, and you can see the green arrow is pointing to that area. And so go ahead and test it out, and please let us know, where are you participating today? In what part of the world are you located? Now, joining us today, we've got Wendy, who is part of our customer support team. And so she's going to answer your questions if you have a few, and she's very well versed. She's been with LER for many years, maybe 10 even. And so, she's happy to answer your questions, but she's also going to leave a couple of questions for Sakita and I to answer live. If you're having any tech issues, Jill is also on the call. She's from our wonderful tech team, and she can respond if you do have if there's any concerns that you have. So indeed, if you are watching us later, watching this recording later, you're welcome to reach out to us at support@lactationtraining.com if you do have any questions. Now let's dive in and take a closer look at what a lactation consultant is and how you can follow your passion and become one. If you decide to become an IBCLC, you'll join more than 35,000 of us in over 131 countries and territories. Credentialing as a lactation consultant is offered by the International Board of Lactation Consultant Examiners. Take a look at their website. They have different regional offices depending on where in the world you reside or work. Review the requirements and the pathways to become eligible to take the IBLCE exam. What do you need to know? The detailed content outline, it was also known as the exam blueprint, is based on surveys of IBCLCs in various practice settings around the globe. The outline covers all of the topic areas and the chronological stages an IBCLC needs to know in their work. LER courses cover the entire detailed content outline, and our courses are approved by LARC. That's the organization that evaluates and approves lactation consultants training courses. Sakita is going to review a few questions to ask yourself today before you get started. Sakita?
Yes, thanks, Angela. So yeah, I want to just implore you to maybe write these questions down because we're going to take a dive into some of the skills, not all of the skills, but some of the skills that is necessary um, to really master, really what IBCLCs do. Recognizing that some folks don't know what we do, some folks thinks we go to room from room to room to room, just latching babies all day long because they're ready to feed all day long, right? But that's really just that doesn't cover even maybe 2% of what we do. So questions to ask yourself about some of these skills is, do I have the skills necessary? And if you don't have the skills necessary, where will I get these skills? And when I talk about skills, I'm not talking about simply just putting your hands on something or someone or just doing. I'm talking about a whole host of skills, from communication skills to interaction skills. So things sometimes that you can't put your hands on. So, reflect on these questions, write them down, and really be intentional about your own journey, because we each have our own journey based on a set of circumstances, and you'll figure that out when Angela started to talk about the pathways. So what makes an IBCLC? Of course, competency is at the top. It is the core of what sets us apart from anyone else as it relates to clinical management of lactation. So when you think of competency, competency is pretty much having the knowledge, the skills, and the attitudes to do something successfully. And so when we're thinking about this, there is a continuum of experts, and sometimes you will hear it called novice to expert, which means someone who has that entry level basic information, but the expectation is that you keep building upon that knowledge so that you're able to manage more complicated cases. And so thinking about what competency is, at the end of the day, at the end of your training, you want to be confident that you are competent so that you are not causing harm. That is essentially the crux and the crucial point of having a competent provider or practitioner. Culturally appropriate and incredible. If you work in healthcare, you might have heard the word culturally competent. However, I and others preferred certain different words, one of those words being culturally appropriate. When you think about competency, just thinking about mastering someone else's culture, sometimes the semantics don't really work out that way. I don't know if we could ever really truly be competent in someone else's culture. However, there are terms like cultural humility. There are terms like culturally relevant, culturally appropriate. And so, in a nutshell, just making sure that we're clear in how we approach other cultures. To be clear, though, we have to be clear within ourselves, and that takes cultural humility. And so culturally appropriate is most appropriate for the conversation. However, delivering care with cultural humility is important. And cultural humility is defined as a lifelong process of self-reflection and self-critique, whereby I not only understand myself, but that I'm sorry, not other cultures, but I also understand with this examination of my own beliefs, my own cultural identities. And so, if you want to find out more about cultural humility, there is so much information out there. You can start with the National Institute of Health, also the Kirwan Institution. There's much information, but that's just one definition of cultural humility. And I do want you to know, though, that it is a lifelong process. And I'll give you an example sometimes in practice what I've heard. And I've heard this recently also. Things like, okay, you walk into a space, there's a certain person there, and I've heard someone say, well, you know what, they don't really, it's not in their culture to do this. Or I've heard it's not in their culture to breastfeed in the first couple days. One of the things you want to do is refrain from saying that, because you really don't know. And also, you want to think about that there are subcultures within cultures. So, unless a person has really told you, the person that you're encountering has told you, well, that's not a part of my culture, then really refrain from that type of thinking and that kind of one size fits all as it relates to cultures. When you walk into situations such as the one I just explained, and you make maybe a comment like that or a thought like that, or you proceed in your ways of being in that manner, sometimes you can lose credibility. And so you really want to make sure that you're delivering culturally appropriate care, but also that you are credible. So let's take a little deep dive into what credibility really means as it relates to practice. Sometimes we are asked questions that we do not know. And even still, I am asked questions that I do not know as it relates to certain topics. Are you the person that will try to answer based on your lived experience? Or are you the person that says, hold on, let me check that out, let me get right back to you? I can tell you that if you try to answer off your own experience, you are not a credible person. However, if you take time and you think about it and you go back and you say, hey, I was able to find out some information, and this is the source, talking about reputable resources. And this is what most families do, or this is what the literature says. So you really want to make sure that you're delivering information in a credible way, keeping in mind that no, we're not all walking dictionaries, walking computers. Information is at the click of our fingers. But when you're interacting with someone, making sure you take the time to pause, consider what they've asked you, consider if you really know the information, and if you don't, please give credible information. One of the things about being a lactation consultant, either you love us or you kind of just don't deal with us. And that's just the honest truth. I believe in, like, when we say real talk, this is real talk. So imagine if you're given information that is not credible. When you lose credibility as a lactation consultant, that translates to other IBCLCs losing credibility. So that's really the key point I want to drive in when we talk about credibility. Policy advisor, creator, and advocate. So, a couple things we do. We advocate. IBCLCs advise on policies. IBCLCs create policies. IBCLCs are stakeholders of policies. So we're involved in policy, and you want to keep that in mind. It's important to know, though, that we need policy work in this area. If you notice, there's lots of policy work going on. Most recently, the PUMP Act is one of those policies where lactation providers across the nation had input into that policy. So if policy is your strong suit already, then you have that skill. However, if policy is not your strong suit, just remember that even being at the table, even using your voice is a part of that policy realm. And it's a part of your advocacy. um, Truly, really, advocacy is just making sure that folks know where you stand on what's important to you. And so, advocacy is a big part of what we do and who we are. And it's just the public support and recommendation of a particular cause or policy. So, if you're not a policy person, just know that you deserve to be at all tables, listening to how policies are created and sharing your perspective. The issue with policy sometimes is that sometimes policies can inadvertently cause harm based on some of the language that's being used. And so that's why it's important to listen closely, to be at those tables, and to really use your voice when something just doesn't sound right. Problem solver and researcher. So I talked about what 1 to 2% of what we do. Being a problem solver is about 90% of what we do with families. Every single family that you encounter will have their own set of circumstances. Their concern may be latch and positioning, but they may have a different assessment than the family that you saw before. So when you're called to assist, you're usually called based on some type of problem or issue that the family is experiencing with breastfeeding or chest feeding. So you really try in these instances to be very careful with framing situations from this one size fits all. Know that one size never fit all. and we really should be problem solving from looking at situation through a lens of this individualization of not just the person, but the family, the supports, and even their labor experience. All of those things are going to take part in you problem solving to help folks. So, along with being a problem solver, you can also um, pair that with being a researcher. There are folks in lactation land that actually do research, meaning they do experimental um, research, or they do um, qualitative research. They do all types of research. However, you don't have to do research in those type of academia ways, but you have to know where to go get resources for um, issues that you may have to look up, that you have to problem solve. Like I have never seen this case before. I need to go and reference and research so that you know how to move forward with a care plan that actually works for that family. High level lactation care, and I'm going to flip that and say skilled high level lactation care. Earlier, you heard me talk about novice to expert. So, when I talk about high level lactation care, I am talking about cases that you encounter that may be above the average basic latch and positioning, going back to work, engorgement. When I talk about high level lactation care, I'm talking about whether or not you know how to manage someone who is in the ICU, who's intubated, who's had brain surgery, who's on certain types of medications. Are you able to deliver that type of care? Now, I will tell you that right when you leave whatever training your whatever pathway you're on, you may not have that knowledge of this high level. That's a truly high level. Someone who's had a craniotomy intubated. I've had that type of case. And so I'm referencing that, and I understand that that's not the everyday case. But what I do know is that those cases need to be managed in a way that we are managing and we're thinking about holistically what's happening to the brain. We know where prolactin and we know where oxytocin originates from, right? The brain. So we really have to be mindful of really putting together, again, problem solving at a higher level of what are my next steps with this particular patient that's in this high acuity status. And so when you're doing your training, try to seek out those high level cases. Don't shy away from them. You know, I know that I talked about someone that's intubated and all of that stuff, and you may not encounter that a lot, but really think about what that type of care would look like should you ever be called to do something like that. So, yes, you need to know about the brain. Yes, you need to know about lactation acuity levels, because lactation acuity levels, set apart who needs what type of assistance and when. And when you know those things, then that's when you get the optimal outcomes for your clients and your patients. So, if you were asking yourself right now, do I have the skills necessary? I'm going to tell you, I just gave you a really, really, really drastic situation. And you may not have those skills right now, but please don't fret. Don't get scared. It is just really telling you what's real, what sometimes happen in this field, and that sometimes it's just not always romanticize like the skin to skin, the baby latches. Sometimes things happen along the labor process that causes us to have to think differently than the um, low acuity cases. So if you don't have those skills, don't worry. Live long enough, you'll get those skills under your belt. All right. So, if you're like me, what you learned during the pandemic was that essential became a buzzword. At least for me, it did. And one of the things we found out is that yes, IBCLCs are essential because guess what? Babies didn't stop coming when the pandemic happened, right? And so we found ourselves in a true emergency. And we found that the hospital stays were shorter, lactation care was going by the wayside, and lots of things were happening, and folks needed assistance, and rightly so, because during an emergency like a pandemic, promoting and protecting the ability to provide human milk is critically important. So we're not just thinking about the bonding, we're thinking about the public health and prevention standpoint, particularly during this crucial time. So yes, we are essential. And it's important that when we're called, that we show up and that we show up in a timely manner because truly not showing up in a timely manner really sometimes can break that lactation experience, that breastfeeding experience for that family. And then we're thinking about we're thinking about long-term health consequences for a person not having that timely, essential, skilled lactation care. So I want to make it clear that yes, a lot of folks are like, yep, I'm going to come up, become a lactation consultant. I'm going to do telehealth, and that's the end all to be all. And I want to say to you that it's great that you want to dive into telehealth, but I'm going to also warn you that there are certain areas, rural areas, who were not didn't have the bandwidth, the technology sometimes, all the things that come along with telehealth. And also telehealth is a skill in itself that has to be honed and has to be cultivated. And it's not as easy. As a matter of fact, I want to say I couldn't stand telehealth, but since I've done a few successful ones now, after having done them a few times, I'm able to understand the nuances that happen with it. But I said all that to say, when we are in situations as when you become a lactation consultant, it's important that when families call you, if you're unable to get to them in a timely manner, that you have a network, that you have a resource that you can refer them to. Trusted collaborative care partner. I love this phrase so much because it assumes that you are collaborating with your client. It is the assumption that you are not the center, you're not the decision maker, you are simply collaborating with the family and remembering and grounding that the family and their partners, their needs, their fears, their barriers, all of them take precedence over your goals for them. So I said a mouthful right there, and understanding that the recommendations are clear. Exclusive breastfeeding and human milk feeding for at least 6 months is the recommendation for the best health outcomes for not just the baby, but also the birthing person and mom, right? We know those things, but it's also important that we honor and talk about the family's goals, their barriers. And it's also important that we understand that they are the expert in their situation and that we are collaborating in partnership and in agreement with them to help them accomplish whatever goal that may be. And when you sum all of these things up, that's how you become trusted. That's how you become trusted to do no harm. You become reliable, trusted to say, I see you as a person and we're in this together. There's no hierarchy. I'm not higher than you. We're collaborating to do what is best for you and your family. So I'll give you an example of sometimes how things can go awry. And these things happen even still as I'm talking today, and may happen again. But, say for instance, you're called to assist someone in a clinical situation and they asked for latch help. They need help latching their baby. You walk in the room and you just, you introduce yourself, but you really don't take time to get to know the client you're working with. You don't get time to really assess what's going on. You see that this person is trying to put the baby to the breast, and all of a sudden you just reach in and you're going to help, right? That is a good way to not be trusted, right? Part of being trusted is relationship building. So going into situations like, I know this, I've been teaching this for 10 to 15 years. I'm going to tell you how it should work. Here you go. No, always ask permission to touch. Always ask if they said they needed assistance with latch, what type of assistance were they really asking for before you go in? That's the role that we play. We are there as the collaborative person. In a nutshell, I just talked about culture, care, communication, and collaboration. The person is the center, which means the person is the expert on their bodies and their health and their care. And so I just want to leave you with that. There is a definition provided by the Institute of Medicine, and really it entails that we center the patient preferences, needs, and values in all clinical decision that we make. So I want to leave you with that. I want you to understand that there are certain words that become buzzwords. Please don't let person-centered care become one of those buzzwords. Please practice the art of really saying to someone, I see you, I'm going to help you based on what it is you're asking me to do. So we are coming up to the next steps. The what you really came to find out is how do you become an IBCLC? So Angela's going to take a deep dive into it. When she is doing this, these are other questions you want to write down and reflect as you make your plan and your journey. What pathway are you going to take? She'll talk about those pathways. What does the local market look like in your area? Are there IBCLCs everywhere? I'm going to tell you it's not, but thinking about that, where are IBCLCs practicing in your area? And how does achieving and starting this journey, how does that fit in with your life, with your family, with your work, all the things that you have going on? So those are other questions to reflect upon. And I just want to leave you with those questions because Angela's going to answer a lot of the questions that you came here wanting to know. Angela, take it away.
Thank you so much, Sekeita. Okay, so the roadmap to the IBCLC looks a little something like this. It can feel a little complicated, but I'm going to go through each one of these different points. So first, you need to choose a pathway. We're going to come back to this in just a minute. Each pathway has three different components. First is education, the second is clinical hours, and the third is getting ready for the test. So the first component is the health sciences education. It's typical education for a healthcare provider. There are 8 post-secondary or university level courses and 6 general education subjects. You can find a full list of each of the 14 subjects on the IBLCE's website. You can search for it, or there is a link in the resource document, which is attached to the webinar. You'll notice there that it says handouts, and you can download that, take a look at that, and it has a few really helpful links. Now, the 8 university level courses are, and you don't need to write these down right now, but they are biology, anatomy, physiology, infant and child growth and development, introduction to clinical research, nutrition, psychology or counseling skills or communication skills, and finally sociology or cultural sensitivity or cultural anthropology. They can be online or in person, as long as the institution is accredited to provide the learning. Now, if you took these courses during your college career, they count, even if that was 20 years ago. LER partners with Walden University to provide these basic courses. Walton University is an online university. The advantage of working with them is that they have actually selected courses which fit the IBCLC requirements. Now, 6 of the general ed subjects are medical documentation, medical terminology, occupation and safety and security for health professionals, professional ethics for health professionals, universal safety precautions and infection control, and basic life support. Now, 5 of the 6 general education courses can be taken through LER. The only one you're going to need to search for is basic life support. In many countries, there is an in-person skills check for this training. Now, I've heard of some organizations providing this training completely online, so it's important to check with your local resources. The guide provides general descriptions for typical courses in the subject area, the guide meaning what you'll find on the IBCLC website. Now, do keep in mind that the IBCLC is an international organization. The names they use in the documents for different courses may not exactly fit the description of the course at your accredited educational university. That's okay. IBCLC uses broad terms with the understanding that there is no universal description for what a course in, say, clinical research is going to cover. So why are all these courses required? The IBCLC is a standalone credential, meaning you don't need another certification, degree, or license to practice as an IBCLC in many areas. Once you pass the exam, you will be an allied health professional. The courses will help you to be prepared for your career, as well as to help you pass the IBCLC exam. So the second thing you need is lactation-specific education. This is where LER has you covered. The education should be comprehensive and cover the IBCLC detailed content outline. IBCLC requires at least 90 hours of lactation education and 5 hours on communication skills. Our 5-hour course is specific to lactation and breastfeeding care to help you in your practice as a lactation consultant. Now, the third component is lactation-specific clinical experience. This can include in-person consultations, telephone consultations, or online breastfeeding and lactation care that supports breastfeeding families. It also includes lactation assistance to pregnant and breastfeeding clients and lactation education to families and/or professionals. These hours are to be obtained within the 5 years immediately prior to applying for the exam. Now, how many clinical hours do you need? Well, that depends on your pathway. So as I said, they need to be accrued in the 5 years before you apply for the exam. Pathway 1 is for health professionals and those who provide breastfeeding support through an IBCLC recognized breastfeeding support counselor organization. Health professionals include, according to IBCLC, physicians, nurses, midwives, dietitians, physical therapists, speech pathologists, and others. Breastfeeding support counselors include those accredited through organizations such as LER. We are a breastfeeding support organization. Others include La Leche League International and the Australian Breastfeeding Association. As of today, there are over 40 organizations that have applied to IBCLC and are approved. Pathway 2 applicants must complete a comprehensive academic program in human lactation and breastfeeding through an accredited university. Their education has both the didactic and clinical components, and they require 300 clinical supervised hours working with breastfeeding families. Now, Pathway 3 is a structured mentorship program between the IBCLC and the applicant. Now, the IBCLCs must be in good standing with IBCLC. Those who choose this pathway must have their program pre-approved by IBCLC prior to beginning their clinical hours. I understand this is happening relatively quickly now, like within a few weeks. A quick note, for those of you who have breastfed, chest-fed, or provided human milk for your own child, the hours you spent nursing, pumping, and helping your friends doesn't count towards your clinical hours. Now, while 500 or 1,000 seems like a lot, there's a really good reason why. Each candidate needs to have the clinical experience so they can provide competent care as an IBCLC. Sort of like the examples that Sekeita gave us earlier. in actually seeing clients. She has seen a lot of different things. I've seen a lot of different things, and they really do help you to be a better lactation consultant and serve families. If it's any consolation, the number of required hours used to be a lot more. I've known IBCLCs who needed anywhere from 2,500 to 8,000 clinical hours just to take the test. Now, candidates who are applying for the IBLCE exam through Pathway 1 need at least 1,000 hours. For the candidate who's also a healthcare provider, those hours can be done in a hospital, birth center, clinic, lactation care clinic or practice, or through independent practice as a licensed or registered healthcare professional in a non-healthcare setting. For breastfeeding support counselors from an IBLCE recognized organization, those hours can be earned either in person or online. The location and type of support depends on the criteria provided by the recognized organization. The hours need to be counted on an hour-by-hour basis. So 2 important points about clinical hours. It's important that you document the hours as you accrue them. Be very detailed in case IBLCE chooses to audit your application to take the exam. They may want to see some sort of documentation, such as a spreadsheet or something else where you counted your hours. And the second important point about Pathway 1 is these hours do not need to be directly supervised. Now, Pathway 3 requires 500 hours of clinical experience. It's best done in a busy practice setting where you can work with many breastfeeding, chest feeding people, and those who are providing human milk for their babies each day, such as a hospital or clinic setting. The hours count towards the 500 only start counting when you're actually working with families. Observation and orientation hours don't count. The clinical experience is graduated. That is, it starts with observation and then doing tasks under supervision and then completing those tasks independently with the IBCLC close by to ask questions. Now, LER does have an internship program with many sites around the United States. Reach out to support@lactationtraining.com and we can connect you with Amy Black, who is our clinical internship director, and she can let you know if we have a site in your area. If we don't have a site in your area, she's going to give you suggestions on how to work with your local hospital to facilitate that internship site. Now, one thing Amy did want me to mention is that you, as I said before, you can't start to count those hours until both you and the IBCLC are comfortable with you working more independently. Most interns are going to spend about 75 hours in orientation before you can begin to count to the 500 hours. So take a look in your community and see if you can find a willing internship site or mentors. You may need to reach out to a few people to find someone with the time, experience, and capacity to agree to be your mentor. It's important to find a good fit. Talk to others who've been through Pathway 3 to find successful strategies in finding that good mentor. Now, while this pathway has an additional step or two, is it worth it? It is. And the reason why is because IBLCE reports that students who come through Pathway 3 score best on the exam. I think it's that mentorship piece which is so important. Learning from an experienced clinician is well worth the extra effort involved at the beginning of this pathway. A lot of people are asking whether or not they can accrue clinical hours via telehealth during the pandemic. The quick answer is yes. The longer answer is paraphrased on the IBLCE documents. The guidance has been extended until 30 September of 2024. Do keep an eye on the IBLCE website because that's where you're going to find the most up-to-date information. Now at LER, there are 2 different ways to gather your lactation-specific education. One is the Lactation Consultant Training Program, which is 95 hours front to back. The other is either core or bridge. They are designed to meet your education needs depending on your background and previous lactation training. So LCTP is a 90+ hour course which is eligible for CERPS, CME, and nursing contact hours. It's intended for those who do not have any lactation education and they know they want to be an IBCLC. We have more than 35 of the most knowledgeable, experienced instructors who are practicing lactation consultants, researchers, and authors who teach in our courses, including Sekeita and me. Our classes are economical. You can view them on a variety of devices, such as your computer, a tablet, or your phone. They're optimized for a computer, but they can be reviewed later when you're on the go. We've been educating people in person and online since 1990. We update our course information with the latest peer-reviewed evidence on a regular schedule, but we will update sooner as new evidence emerges. Have a question for one of our instructors? You can send us an email to our support forum, and we have IBCLCs available to answer your question. You want to discuss a concept with your fellow students? We're discussing innovative ways for people to connect, so stay tuned for more information. Upon completion of the 95-hour course, you're eligible to take the Certified Breastfeeding Specialist exam. The exam is included in the price. Once you pass, you are a Certified Breastfeeding Specialist. This is to recognize you for the level of education you have attained. With this certification, you can begin to collect your hours towards the IBLCE exam. Now, if you're not sure where to start, or you already have some lactation-specific education, then we have our core or bridge programs to meet your needs. They have the same advantages as the LCTP course. Our initial course is called Core because it provides you with the core lactation education you need to understand what it means to begin supporting the normal course of breastfeeding. It's 52 plus hours of online education. It covers the basics such as anatomy and physiology of lactation, infant growth and development, supporting the preterm baby, medications and breastfeeding, and many more. At the end of the course is the Certified Breastfeeding Specialist exam. The bridge course is ideal for people who have the basic lactation education components and they need that additional 45 hours to qualify for the exam. Topics in our bridge course include legal and ethical concerns for the lactation consultant, infant feeding and disasters, breastfeeding the infant with medical challenges, case studies, and amazing clinical skills videos. Not sure where to start? If you're new to the profession, I would suggest the core course. Get your feet wet and see if becoming an IBCLC fits. Our 90-hour course, as well as core and bridge, are available in Spanish. Capacitación en Lactancia is our new website, which provides the same high-quality education found on LER in Spanish. At LER, we believe that access to high-quality lactation education should not be limited to those who live in countries with high incomes. We recognize that in many parts of the world, the relative purchasing power of a local currency may make the cost of lactation education inaccessible. As part of LER's commitment to increasing access to lactation training worldwide, our pricing is adjusted according to the student's country of residence. In alignment with this continued commitment to diversity, we proudly announce our Rising Tide Lactation Equity Scholarship Program, which is designed to increase the number of Black, and our Juntos Triunfamos Lactation Equity Scholarship is for Latinx and or Hispanic IBCLCs in the United States. We recognize one of the greatest obstacles to entry into the field is access, specifically demonstrated by financial barriers. LER will remove that barrier for the Rising Tide Scholarship or Juntos Triunfamos awardees. We alternate these scholarships each year. You can find out more information on our website, and the call for the Juntos Triunfamos Lactation Equity Scholarship is open now. This is October of 2023, and it is open until 31 October of 2023. So if you identify as Hispanic or Latinx and reside in the United States, I encourage you to apply. You can reach out to support at lactationtraining.com for more information, or if you receive our newsletter, it was in the previous newsletter, in the October newsletter. Our team is here to help you now and in the future. We have tech support open 7 days a week. You can get your questions answered by content experts in the field. And we provide ongoing support for the next steps in your lactation career. So please do let us know how we can support you. All right, Sekeita, thank you all for listening today, and thank you so much for your time. So what are the questions that we have?
You know, Wendy is so amazing.
They're all
She
answered?
she answered all of the questions. So I want to allow a few additional moments for folks who may have questions to answer them. You know, we do these live so that you have a chance to state your specific questions as it relates to you personally, and we will answer those. Sometimes we answer them live, and sometimes, excuse me, Wendy answers them. And basically, she's done that. And so,
Well,
you know,
I see a question. I know a question that a lot of people are asking. It's about our new program
ah,
to allow folks to acquire their clinical hours through the hours. We're calling it the hours program. And I just put myself on the spot. It's the hands-on understanding and resources. I think it's for success, HOUR, resources for success. Yes, that's it. So the hours program allows you, those of you who are CBSs, who've gone through either our 54-hour or our 95-hour training, to start to support families and to count those hours. And the nice thing is that not only do you just take the didactic portion, but also you have us, Sekeita, myself, Julie, Kim, Amy, all sorts of folks at LER to help you in your journey as you're supporting families. And so indeed, I actually was chatting with someone earlier today who had a question for me about they have an opportunity to offer lactation support at a local clinic, and they were curious what they could offer to the clinic. And we talked about how they could provide a class, on the basics of breastfeeding. And this person said, well, I really don't, I've never taught a class like that. So what could it look like? And so I gave her a few resources online, and I said, please reach back out to us and let us know what the curriculum is, right? I'll take a look at the curriculum, or Sekeita would be willing to take a look at it and just see, does it cover the basics of what, the families may want? And of course, I always ask the question of families, right? What do you want to know about breastfeeding, or what do you want to know about human milk feeding? That's usually a really good first question, or providing them with a few little facts. But we can take a look at that and see. Or a couple of times a CBS has walked into a situation. So to your point earlier, Sekeita, about acuity, they walk into a situation where they think it's just a latch issue, or maybe it's a little issue with milk supply, and they walk in and it's like, whoa,
right.
there's a lot more which is there. And immediately they realize, oh my goodness gracious, but walking into that space humble and saying, I can help you with this aspect. I'm not really sure about that aspect. You know what? Let me reach out to some folks and let me get some more information for you. And so indeed, I've had people reach out to me and say, oh my goodness, this is the situation. And
Yeah.
that's why, to your point earlier, you also said, find out who's in your community,
Yeah.
because networking with folks in the community is important, so that when you do walk into that situation, not if you walk in, but when you walk into a situation like that, right, you're ready and you've got your resources, you feel comfortable. And if you need someone else to talk to, feel free to reach out to us at support@lactationtraining.com, or,
Yeah.
give us a call.
Yeah, Angela, thank you for all of that. Good stuff. Good stuff. I want to honor that this is probably the first time I've seen this. There are two people with their hands raised, and I'm not sure if we have capability to hear the questions, but definitely we want to encourage you that if you have a question, to put it in the questions area. But Angela, do we have the
Yeah,
capabilities?
we could ask the person if they want to unmute themselves,
Ah,
and we could give it a try. We haven't done that in a minute, but we could give it a try. Oh, Sekeita's ready. Sekeita's ready to
yes.
try this. Okay,
Listen, I
great.
want to hear some voices. It makes me feel like I'm really talking to people.
Besides just me, right?
Yeah.
Okay, well, why don't you go ahead and answer that question? And actually, I will try. I don't want to call this person, I don't want to say this person's name. So
Oh,
if you raised your hand inadvertently, please try to lower it. Otherwise, I can reach out to you and see if you'd like to ask a question. So go ahead.
Yeah, so the question is the lactation consultant trait. I'm thinking, yeah, the lactation consultant training provides all the education needs to take the exam, correct? Is this better than relying on previous education? It looks more specific toward infant and lactation. So I can say to you that um, all you need, it's not the all the education you need. So if you think about it, again, I'm coming from the context of there are additional health sciences courses that you need in addition to clinical hours based on what pathway. But our education is comprehensive. Our education is taught by IBCLCs. Some of the IBCLCs are nurses, public health persons, physicians, IBCLCs, social work. It just depends. But our education is specific because it is really done by experts in the field that are practicing this work. And so I hear something.
Yes, I unmuted someone. Hey,
Hi, my name is Natalie.
hey.
Hi,
So,
Natalie.
hi, I'm currently at CLC, and thank you for this. I've been struggling how to start that pathway for the past 5 years. Um, so my question is, so I took back then I was a medical assistant, so I took a few courses like public speaking and all that stuff. So I did get my transcript. I did that. So, but who do I send that so they can? Is it with the person or the people or the organization that I'm starting the program with?
So in order to take more breastfeeding specific training, you don't need to send that to anyone. This is just, you check your college courses and everything just to make sure that you've got them. And
Mm-hmm.
so take a look on the IBCLC website, see what the courses, what those college courses are supposed to be, and then
Mm-hmm.
sort of take a look at what you've got and say, does this fit? I think this fits. There isn't anyone that you can just ask, can you check my transcripts and make sure that it fits? Sadly, they don't offer that service. And so if you determine that it fits, then it probably does.
So I would need to have the description of the course. Is that correct?
That would be good. Yeah. I mean, if it's something simple like biology, then that's
Yes.
great. But,
Oh,
you mentioned like public speaking. And so
yes.
you would have to see if there's any sort of description that talks about communication skills specifically,
Yes.
because public speaking is a different skill set than counseling.
Okay.
Yeah.
Okay.
Good.
Yes. Another question. I currently took a CLC class. It's I forgot them, but they cover the counseling skills and all that stuff. Does that count too? That we that towards the college, or I'm not sure if I'm making any sense.
You're totally making sense. You got it, Sekeita?
Yeah, so if you took that course, you're asking if it counts toward your college courses?
Yes,
That would
because
be no. It would be no. So your college courses have to come from either a community college or a four-year college. It
I
has
see.
to be the health sciences courses. And with, for instance, say for instance, if you do have courses from a community college, you would be able to get that catalog to be able to really say, okay, this course was this many credits and this is what this course entailed. So, yeah, it wouldn't be your certifications, any certification you have would not be considered a college course.
Thank you.
You're welcome.
Thanks, Natalie.
Yes. All right. So there's a question also for that question that I was answering before I heard something. I apologize. I got real excited about that. The second part to that question is it better than relying on previous education? It looks more specific toward infant and lactation. It is not just infant and lactation. There's also the birthing person and mothers or maternal aspect as well. Breast anatomy, all of that is included. It is a very comprehensive course. So I just wanted to go back to that. The next question here is, if I'm doing pathway one and have been contemplating the internship, is this something that could be done?
So
Pathway, go ahead, Angela.
well, the answer is that IBCLC wants you to pick a pathway and stay with it. And so if you're doing pathway one, assess and see how many hours you have. But if you want to do pathway three, your hours can't be counted until you actually get that application. You find a mentor and get that application into IBCLC. So
Angela, someone else has their hand raised.
I just unmuted them. There we go. And
Yes.
so to that person who has your hand raised, and you asked a question as well in the chat
Hello.
about, hey, how are you?
Hi.
Hi, my name is Beverly Williamson. So I'm looking to become an IBCLC, and I've heard that getting a pre-nursing or nursing degree will make me exempt. So currently I'm taking my health science classes, and I should be cleaning, sorry.
You may be doing that, yes.
I will be, but I should be completing them in 2025. And we'll be getting my AA in pre-nursing and then going into a nursing program in 2025 of fall. So my question is that would I be able to do an internship to get those clinical hours before I complete my whole health science classes? Because I know being exempt kind of makes it so that would wouldn't be considered. But I'm really adamant to I want to get out there and start getting those clinic hours now, within the next year.
Right. So I think that it's interesting you use the word exempt, because I don't know if you would be exempt necessarily. It's just that you would have the requirements once you've got, anatomy, physiology, things like that. And going in as a nurse means that you're going to have the college courses, right? You're going to have that piece. Can you accrue clinical hours before you get that nursing degree or any sort of certification? Absolutely, you can. The thing is I would encourage you to take the 95 hours or at least the 54 hours so that you know that the information that you're providing to folks is accurate. And especially if you've got capacity now, then absolutely go become a CBS and start to gather those hours while you're in nursing school. Anything else to add to that, Sekeita?
I do want to add something. Having been a nursing educator and taught clinicals, one of the things that, as Angela was speaking about, it's important to make sure that um, a understanding that the journey to becoming a nurse is separate and different from the journey to becoming an IBCLC. That's the
Yes.
first thing. But the second thing is that when you begin your actual clinical courses for nursing, there are lots of clinical hours and there's a ton of work. And so when I was talking about asking yourself those questions about how are you going to fit this into your life, really think about that
Yeah.
from a standpoint of, okay, not only am I going to be trying to get clinical hours in for nursing, but I have these lactation clinical hours. Also think about the fact that 5 years of clinical hours is really with what you do with the past 5 years, Angela. Is that
Yeah,
correct?
recent
Yes.
5 years, right? So
Recent 5 years, right? And so you really want to be real intentional about what that looks like for you. But you wouldn't be exempt. The other thing about the pathways is when you become a nurse, you don't actually just have to do pathway one. You could also do pathway three. Pathway three is the pathway that I chose, and I was a nurse before I became an IBCLC. So really thinking about, again, you have a different journey. How does this all fit in, and how do I make it fit in within the constraints that you're going to have?
Yeah, you make a good point. Thank you. I had I had got my birth doula certification in 2013. So I had a little bit of experience helping some mothers do lactation, and then that's kind of where my heart is. So, and I want to do the nursing so I can kind of be in the women's maternity ward helping those mothers in their postpartum initial days.
That's awesome.
I love it. Thank you for sharing and best wishes along your journey.
Okay, thank you guys for the information.
You're welcome.
Thanks. Okay, great. So I've invited one more person to unmute. They haven't yet. And so I think we'll go ahead, and there's no other questions. So I think we can go ahead and wrap it up.
Oh, hello. Sorry. I didn't
Hi.
realize that you did that for me.
Hi. Yes, you're double muted. You mute yourself and we mute you. So I undid the us muting you. Hi.
Hi, my name's Tara. I've been a NICU nurse for a long time, and so I believe that I'm pathway 1, but I don't know how to calculate my clinical hours because I do spend a lot of time assisting with breastfeeding and even sitting in on lactation consultations, so I'm not sure how to calculate that.
So yeah, there's a calculator on IBLCE's website so that you can calculate how many hours that actually, what percentage, I should say, of the amount of hours that you work that can be used toward those hours.
I did see that page. It looked like I could just put down the number of hours that I worked in the last 5 years at the bedside, but what percentage of that can I apply towards lactation clinical experience?
Okay, so I'm going to answer this question based on 15 years ago when I first sat for the exam.
Okay.
Back then, I could use a third. I
Okay.
don't know what that breaks down to, a third of the past, again, 5 years.
Mm-hmm.
But I
It's
believe I didn't go that route. I did pathway 3.
3.
Okay.
So, but I do remember exploring that and was like, whoa, it's going to take me some time to get this, and I can't do this with this. So yeah.
Right. So Tara, it's you making that. How much would you say you spend on lactation on a weekly basis?
At my current position,
Mm-hmm.
I would say 15% of my day. At my previous position 2.5 years ago, where I came from, I was there for 18 years. It was a breastfeeding friendly hospital. I'd say more like 20% of my shift was spent
So there you
doing.
go. And you work full time?
I've been 48 hours a week, so.
Yeah. So just calculate the 48 times the number of
No,
weeks
I'm
that you
sorry. I'm
work.
48 hours
Oh,
a pay period. No, sorry, 24
uh,
hours a week.
Yeah.
okay. Yeah. So then just calculate that out. And 24 hours a week times 52 weeks, or maybe a couple off if you get a little time off. And then you take that number and then add it to calculate the percentage of the 20% of your time, and then the 15% of your time, and then that's going to give you the numbers. And
It's
I would
about
do it
1,000 hours.
year by year. Yeah, I would do it year by year to see
Okay.
how close you are. And then, just remember that if let's say you say, oh, you know what, I can't really do it now, but I want to do it next year, then just make sure that, because remember that fifth year is going to rotate off. It's going to become a sixth year. And so you want to make sure that you're doing the percentages. And also you may realize, well, gee, I'm going to have to spend more than 15% of my time working with lactation. So then you offer to your colleagues, when you're working the shift, and say, listen, let me pick that up. Let me pick that up. So you can increase your percentages a bit.
Okay.
Yeah. Makes sense.
Yeah, that's helpful. I did start my education with LER, the 95 hours, so I'm in the middle of that. But I can't register for an exam until that's completed, correct?
Correct. And you have to have all of your hours complete. So everything has to be complete before you can apply. The application window is open now. I think it closes at some point in December. I know Wendy will type it in the chat if I'm wrong.
I thought it was November to February, November to January, no? For the April exam?
Is it? I think it's December, but you know what? Why don't I take a look real quick and see if I can figure it out, or if Wendy types it into the chat. There we go. January 4th, she says. See? Thank you, Wendy. So yes, you have until January 4th to accrue
Complete
everything
the hours
and apply.
Okay,
Yes.
to be able to test in April. Okay.
Correct. Yeah, you do have to you have to do the application, months in advance, which is a bit of a pain, but at least, you kind of get everything in a row.
Yes. Okay, thank you so much.
You're welcome. Thanks for asking.
Mhm.
Okay, great, Sekeita. So there we go. All questions answered. I think we're doing
Yes.
well. Yes? Yes.
I love that. I love that we did live Q&A. That was good.
Next time too. We have to do it again. Have to do it again. So great.
Okay.
Well, thanks everyone for joining us today. Do reach out to us, email us if you do have further questions, and have a great rest of your day.
Yes, goodbye. Thanks for joining us. Good luck on your journey.
Bye, everybody.